गुरु प्यारे साथ संगत जी, वाहेगुरु जी का खालसा, वाहेगुरु जी की फतेह। सिख सोसाइटी कैलरी वालों चलाई जा रही पंजाबी हेल्थ सीरीज में अगे बढ़ाते हुए मेरा नाम है शान सिंह चीमा तो मैं थोड़े सारे का शुक्रगुजार हाँ कि तुसीं अज अपना कीमती समा कट के इस महीने साडे नाल फिर शामिल होए हो। पंजाबी हेल्थ सीरीज का मकसद है कि असीं संगत को एजुकेट कर सकीए भी अपनी ते अपने परिवार की सेहत की होर कितना ख्याल रख सकते हैं ते नाले जिहड़े कैलगरी दे विच अपने हैल्थ केयर प्रोवाइडर ने डॉक्टर हो गए नर्सिस अपने अपने फील्ड के रिसर्चर उन्होंने असीं तुहाडे नाल मिला भी सकीए। अज का विषय है वैक्सीनेशन के उत्ते जिहदे बारे बहुत लोगों को वख-वख विचार सवाल या चिंतावां होंदियां हैं। सानू इस टॉपिक के बारे डॉक्टर जगदीप तुली अज होर दस्सणगे। डॉक्टर जगदीप ने अपनी बैचलर ऑफ साइंस इन फिजियोलॉजी यूनिवर्सिटी ऑफ अल्बर्टा से कंप्लीट की थी ते नाले अपनी मेडिकल डॉक्टर ऑफ मेडिसिन सेंट जॉर्ज यूनिवर्सिटी वेस्ट इंडीज़ तो कंप्लीट की थी। ये 2020 तो लैके US बोर्ड सर्टिफाइड पीडियाट्रिशियन हैं ते ये हुण अपनी कैलगरी दे विच प्रैक्टिस कर रहे हैं। हुण मैं डॉक्टर जगदीप को बेनती करूँगा कि तुसीं अपने आप की प्रेजेंटेशन शुरू करो।
Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Good evening, everybody. Just ahead of time, I will be presenting mainly in English, but the slides will be both Punjabi and English, so just feel free to read along as I talk. Thank you for being here today. My name, as Ishan mentioned, my name is Dr. Tuli, and I am a pediatrician working currently in Chestermere. Today, I would like to talk to you about one of the most important tools we have to keep all of our children healthy, which is vaccinations. We all want the same thing for our children. We want to keep them safe, healthy, and protected from harm. Every day we make decisions about their nutrition, their sleep, their education, and their safety. Vaccines are one of the important decisions that helps them protect them from serious infectious diseases. Over the next 15 to 20 minutes, I will be discussing a couple of the topics that you see on the screen in front of you. They will include what are vaccines, how does the immune system work? How do vaccines help us protect against illnesses? Herd immunity, vaccine safety, some of the common myths that we hear about vaccines, and the impact that they have on public health. Alright, so just starting off, what is a vaccine? A vaccine is a preparation that is given to stimulate the body's immune response against a specific infection or disease. A vaccination is the act of receiving that vaccine to prevent infectious disease. So in simple terms, basically, a vaccine is used to train the body's immune system to recognize and fight against dangerous infections before they take hold and cause a massive or serious illness. You can think of a vaccine as like a practice drill for your immune system. Just when your firefighters that are training all the time to protect and to prevent a real emergency from happening, vaccines will allow the immune system to prepare before the actual infection occurs. Vaccines in general do not cause the disease that they are designed to prevent. Instead, they expose the immune system to a harmless part of the germ or a weakened form of it, which allows the body to then learn to defend itself, and I'll go into more details of that in a few slides. So, quick slide just showing you the different types of vaccines, because they're not all made the same way. Sometimes we assume that all the vaccines are the same, but there are many different types of vaccines, but the end goal for all of them is the same, is that they're designed to teach the immune system in a safe manner how to react appropriately. Some vaccines, this one's good. Oh, go ahead. One back. Right there. So these are the different types of vaccines that are available. Some vaccines contain a weakened version of the virus. These are called your live attenuated vaccines. A big common example of that one is usually a flu shot or even MMR. The virus in this case has been changed so that it cannot cause disease in healthy individuals, but can still help to stimulate a strong immune response. Other vaccines contain an inactivated or killed version of the virus or the bacteria. And in this situation, because the bacteria is not alive, it does not cause an infection, but will still activate the immune system to help recognize it later on. Some vaccines contain only a small piece of the virus or a small piece of the bacteria. These are often called subunit vaccines. The immune system, again, learns to recognize this specific piece and helps to develop protection without exposing you to the full bug itself. More recently, the one that you guys have heard about more recently is these mRNA viruses, kind of with COVID-19. These vaccines do not contain the virus, but they allow the body to take up parts of the germ, produce their own cells, and create aspects that the immune system can then recognize and help fight the infection down the road. Although the way they work is different, the end goal is still the same, which is to help train the immune system safely and effectively before your children actually encounter the real virus in the world. So to understand how vaccines work, it's helpful to understand the immune system, so I'll do a quick overview of how the immune system normally works. Our bodies are constantly exposed to bacteria, viruses, and other microorganisms. Most of these are harmless, and some of these can cause serious disease. And so the immune system basically acts as our defense mechanism. And so if you look at the slides here as examples, but when a germ enters the body, which is one prone to cause harm, the immune system will recognize it as an invader and starts the fighting process. This involves several steps. The first of which are the cells of the body, which are the immune cells, will identify the germ, which then go on to activate a second line of defense. The second line of defense produces proteins called antibodies. These antibodies are designed to basically attach onto the germ or the organism and recognize it as something bad and activates the rest of the system to attack those viruses. When that germ is attacked, it also produces other cells which are known as your memory cells. These are the cells that recognize that infection and that organism and sometimes remain in the body for up to years at a time. What happens with these memory cells is if the same bug, whether it's the next day, years later, multi-years later, enters the body again, these memory cells will recognize it and launch a defense mechanism that is very, very quick. Because the body is able to act so quickly, in a lot of cases, the infection itself caused by the bug can be stopped before it causes any symptoms that you may see. And so it's the ability to remember these prior exposures, these prior infections, that makes the immune system kind of one of the best defense mechanisms that we have. And vaccines take advantage of this process. And then I'll go over this as well, but again, Punjabi English for you guys to read up on. Vaccines primarily work similarly, but they introduce a harmless piece of the virus or the bacteria, which we call an antigen, into the body. This antigen by itself cannot cause the disease, but it does enough to activate the immune system that we talked about previously. And so what the immune system does, it responds to this bug the way it should. It produces the antibodies, it produces memory cells against that specific part of the bug, and the body is now prepped to recognize this bug later on in the future. And so if your child gets exposed to this real virus, so let's say we take a part of the flu, expose them to a part of the flu, if they go in the community and get exposed to the real flu, the immune system is already prepared and can launch a much faster and a much stronger response than if they were initially exposed without the vaccine. In many cases, this can prevent the illness altogether, and in some cases, it may not prevent the infection, but can decrease how severe of an infection and how severe of an illness the child can get. This can help result in fewer hospitalizations, fewer complications, and fewer deaths. Kind of think about it as learning to swim. So you could learn to swim by just tossing your child into the deep and letting them struggle and swim, and some may die and some may not. But the way the vaccines work is you give them an instructor, you start them slow, you let them learn slowly over time, and then eventually they remember and can swim a little bit better. That's basically how the vaccines work with the body to help protect our children. And so why are children particularly vulnerable to vaccines is because they have very young immune systems that are still developing, so are not ready for all the exposures that we are in the world. And so many of the diseases that we protect with vaccines can affect children much more severely. Some of the common diseases that you know about include measles, whooping cough, meningitis, and polio. And they cause a variety of significant complications in children, including pneumonia, inflammation of the brain, permanent disability, hearing loss, paralysis, and even death. Before vaccines, for a lot of these conditions caused a lot of suffering for both parents and for the children that went through them many years ago. And the fear was if a kid got one of these viruses that were very prevalent, the kid could suffer, a kid could die, we didn't know long term how the child would do, which has an impact on families as well. And so because of vaccinations, many of these severe diseases, some of these severe reactions we no longer see. But that is also kind of the catch-22 and the irony of vaccines is because they're so prevalent, we no longer see some of the really bad effects that these diseases can have when we don't vaccinate. So something that you guys may not be aware of is something called herd immunity. So vaccines not only protect the children, but they also protect other members of the community and other children, adults, seniors who may not be eligible to get certain vaccines, as it acts as a natural barrier against them getting the illness as well. We call this herd immunity. And usually it occurs only when there's a high percentage, so a lot of people in the community have been vaccinated against a specific organism or a specific bug. And so when most people are immune, so let's say they haven't been exposed, they're immune to the vaccine, meaning they received it, they got the protection. When that virus enters into the community, it makes it very hard to spread from person to person. Whereas in a community where there is very few people protected, the virus can spread much, much easier, and that's what contributes to the development of outbreaks and severe illness. And so vaccination with this herd immunity helps act as a barrier around people who are vulnerable who can't receive those vaccines. These people usually include newborns, children who are receiving cancer treatment or otherwise immunocompromised, meaning their immune system is not like a regular immune system, people with other immune system disorders, individuals with severe allergies or vaccine components, but also in our population, the very senior and the very sick in the population themselves. And so by vaccinating those that can get vaccinated, we are actually providing a blanket of protection against those who are not able to be protected. The way to imagine this perfect for Alberta is like a fire in the forest. If you have a lot of trees in the forest that are fire resistant, if someone starts a fire, very hard to spread because the trees are protecting all the other trees that maybe don't have that protection. And that's how vaccines work in the same way with regards to herd immunity. And so we like to think of vaccines both for the individual and it protects the community in which that individual lives in as well. Now we'll talk about some vaccine safety, as that's one of the biggest concerns is I'm injecting my child with something that's not natural, what are the effects of it, what are some of the negative features of it. Completely understandable, as we want to make sure you are informed before you make a decision involving giving your child injections. One of the good things about vaccines, it is one of the most thoroughly studied products that we have, so they are very, very well in-depth in terms of the research and the safety profile. Before a vaccine is approved, it undergoes very extensive testing. So before we even provide the vaccine as a clinical trial, there's a bunch of researchers that are evaluating the safety of the vaccine, how effective it can be, what is the proper dosage, and what are some of the potential side effects of providing that vaccine. And even after a vaccine has been approved, it continues to go through continuous persistent surveillance. So doctors informing people what's the reactions they've noticed that may not have been documented, looking at populations that receive the vaccine, if there's any new illnesses that develop in those populations versus people that don't have the vaccine. So it's an ongoing multiple years and years and years of data have available on how these vaccines are safe and how safe they are. Millions of vaccines have been administered worldwide, and we have seen a significant decline in illnesses, more so than the bad effects from those vaccines. And just like any medical intervention, so vaccines are not completely safe. There are some side effects. However, they are one of the more safer methods we have to protect people and children. The vast majority of the side effects are usually mild. They include soreness at the site of the injection, a mild fever. Sometimes kids, if they're really young, will be very fussy, and sometimes they can be tired. These are not really side effects of the vaccine themselves, but more a sign that the body and the immune system is reacting to the injection the way it should be, with the immune system activating itself to get ready for a real infection down the road. Serious risks, so allergic reactions, any sort of cardiac issues, death is very, very rare in vaccines. However, we have to look at the risk factors of what is the risk of giving the vaccine versus the risk of getting the disease protected by the vaccine. And in the majority of cases, the risk of getting the disease and the effects of that disease are much, much higher than the risk and any sort of issue that may come up by getting the vaccine to protect against that illness. So Vaccine myths, there's quite a few. I'll just kind of go over 4 main ones that I hear all the time in my practice. The first one is that the MMR vaccine causes autism. That's one that kind of comes and goes every couple of years, I feel like, in a cycle. This is kind of from a study that was published a long time ago about MMR and autism. However, after significant research looking at the data, they found that that study was actually fraudulent. Some of the data had been manufactured. Some of the things that we look at when we do studies like this were not followed properly. And so it's now been removed as official paper. We don't use that paper as any sort of documentation. We don't look at that paper anymore. And also the author of that paper also lost his license, so he's not a practicing doctor anymore. I don't think he's allowed to do research as well. And since then, because of that study, a lot of other studies have been done looking at connection between the MMR vaccine, which is your measles, mumps, rubella vaccine. And they've done a lot of studies that show that there's no actual link shown between autism and MMR. What we do know is when you give the MMR vaccine, it's the same age as when kids present with symptoms of autism. So we believe it's just a coincidence that when you give the vaccine, they also seem to show autism, but it's not one causing the other or vice versa. Autism itself is a neurodevelopmental condition. It has nothing to do with anything we are injecting into the body, and the scientific evidence is very, very overwhelming that there is no connection between the two of them. Second myth we hear a lot of time is instead of giving 4 or 5 vaccines in one, we give 5 vaccines separately or give them apart. Is there a myth to that or any sort of function? And again, there is no research that shows that giving the vaccine separately or combined has any sort of effect on the safety. By giving 5 antigens, the kids nowadays, they go to the park, they're exposed to probably thousands and thousands of bugs at the same time, and they don't come home sick all the time. So vaccines, the amount of exposure you're giving with an antigen or something forward is very small compared to what they do just by going outside, especially in the winter, going outside to the park with other kids. And so by giving vaccines together, however, while we emphasize that, has a couple of advantages. One, less needle sticks. Every time we inject a child, you run the risk of infecting the site, you run the risk of an injury from the needle. If you can combine it, less needles, less chance of infection for the child, less pain inflicted on the child, less times you have to calm the child down because you're sticking it so many times. Combination vaccines provide earlier protection because you're giving all the vaccines for all the infections at one time, so you increase the rate of them successfully being protected. And it allows us to stick to schedules better, so instead of having to get 5 vaccines every 2 months, we can now get 1 or 2 vaccines every 2 months. A little bit easier to tolerate for parents. Delaying the vaccines, giving the vaccine separately can actually leave children more vulnerable because they will no longer be fully protected against those illnesses that we are trying to protect. Third one I hear is, again, these diseases are not serious, so why are we vaccinating for measles, mumps, rubella? Why are we vaccinating for diphtheria? Why are we vaccinating for pneumonia, things like that? And so that's because the vaccines themselves have been so successful that we don't see a lot of cases of these illnesses, but there are outbreaks that still occur. And we know with data, and you've seen that in the news with measles recently, that when the rates of vaccination decline, the rates of illnesses actually seem to go up. And so that's a correlation of not the herd immunity, not providing the protection when it's needed. And so we know that with these vaccines, that the viruses are still present. We are just protecting our kids from being exposed and hopefully not getting the illness. And it's just the vaccine itself is acting as a control of preventing the spread of these viruses and the breakout of these viruses, which is why we're not seeing kids needing polio treatments or measles treatments too often, is because of the vaccine effect. And then the fourth one I hear a lot of as well is that delaying the vaccine is safer. So if instead of giving the vaccine at 2 months, like until 6 months or 1 year. Issue with that is we don't really reduce any sort of risk of side effects. The side effects, when they get the vaccine at 1 year of age or 2 months of age, there's really no significant difference in what side effects they will have. Like I mentioned, when you delay a vaccine that's been scheduled based on the research, is you actually increase the risk of them being exposed to that illness and thus having a severe effect from that illness. And so the immunization schedule, the way it's designed, is primarily against the bugs or the viruses or the illnesses that can have the most severe effect on the child at that age. So babies get the tetanus shot, they get the diphtheria shot, they get whooping cough, because that can cause more severe illness in that age group. Whereas if you go to an older child, they get more the hepatitis vaccine, they get the Haemophilus vaccines, they get HPV when they're older, because you're more prone to being more sick from those illnesses when you're older in life. So we don't get all the vaccines for all the viruses at one age. It is split up just based on rate of exposure and rate of risk. Impact on public health and how vaccines have been really good It is very hard to state how well vaccines have done for society and for human health in general. They are generally considered one of the best and one of the brightest public health achievements in history. One of the most examples that most of you may have heard about is smallpox, and that was a disease back in the 1800s and early 1900s. Seemed to be killing a lot of people worldwide. We need to know why it's a virus or something like chickenpox in that similar family. And through the process of the development of a vaccine and global vaccination efforts, this has now officially been a disease that's been eradicated. So there are no known active cases of smallpox since 1980, and that's primarily due to the vaccination status of those patients. And one of the things to think about just in that case is the fact that something as simple as vaccinating has basically taken away a disease that was killing millions and millions of people worldwide. Another example of this is polio. Polio has not been eradicated, but back before vaccines started, it used to paralyze about hundreds of thousands of children every year. And nowadays, we have reduced the cases to about 99% decrease in the cases of polio since it has been started. And so now a lot of kids are not spread with not having disability, not having issues with breathing, muscular issues that occur with polio because of the vaccination issue. One thing to note with these successful vaccines and how the vaccinations work is that as you vaccinate more and more kids, the disease itself becomes less and less prevalent, which means you're actually preventing kids from getting super sick. And that makes it easier for families because now you're not worried about your kid getting a virus that's going to affect them long term, which has both the physical, the mental, and the financial concerns they can have on a family. This slide I kind of just added in last minute, but this is a slide that looks at in Canada itself. So on the side, these are kind of your most common childhood diseases that we see: whooping cough, mumps, measles, diphtheria. These are the cases. So this was the number of cases 5 years in the 5-year window before they started doing routine vaccinations for children at that age. And you can see for all of them, there were all at least an 80 to 90% drop off in the number of cases after we started routine vaccinations in the 5 years after. So even within Canada, there's been a massive, significant change in the amount of kids getting sick from these vaccines. And so that's why it's very important that we emphasize and have you understand why we emphasize them so much when you go to the doctor and public health clinics and all of that. So just want to conclude with three key messages. First, vaccines work. They work by training the immune system to recognize and fight dangerous infections before they can cause any sort of serious harm. Secondly, they are safe. They are very well tested. They are monitored continuously, and they have decades of scientific research and medical research behind them that lets us tell you that they are safe. Third, they help to protect more than just the children themselves. They help protect families, schools, communities, and anyone that's not eligible for vaccines or the extremely sick and elderly in the community as well. So vaccination, we feel, is one of the most effective steps that we can use to help protect children and their health. And by vaccinating our children, we are not only safeguarding them today, we're providing a community that can be much stronger and safer and healthier in the future. Thank you very much for your time and thank you for your attention. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.
ਮੇਰੇ ਵੱਲੋਂ ਤੇ ਸਿੱਖ ਸੁਸਾਇਟੀ ਕੈਲਗਰੀ ਵੱਲੋਂ ਡਾਕਟਰ ਜਗਦੀਪ ਤੁਹਾਡਾ ਬਹੁਤ ਧੰਨਵਾਦ ਤੁਸੀਂ ਸਾਡੇ ਨਾਲ ਆ ਕੇ ਇੰਨੀ ਵੈਲਿਊਏਬਲ ਇਨਫੋਰਮੇਸ਼ਨ ਜੋ ਸ਼ੇਅਰ ਕੀਤੀ ਹੈ। ਜੇ ਸੰਗਤ ਚੋਂ ਕਿਸੇ ਕੋਲ ਕੋਈ ਸਵਾਲ ਹੈਗਾ ਡਾਕਟਰ ਜਗਦੀਪ ਲਈ ਤੁਸੀਂ ਥੱਲੇ ਲੰਗਰ ਹਾਲ ਦੇ ਵਿੱਚ ਉਹਨਾਂ ਨੂੰ ਮਿਲ ਕੇ ਉੱਥੇ ਪੁੱਛ ਸਕਦੇ ਹੋ। ਅਗਲਾ ਹੈਲਥ ਸੀਰੀਜ਼ ਸੈਸ਼ਨ ਜੁਲਾਈ 3 ਨੂੰ ਹੋਵੇਗਾ ਸ਼ਾਮੀ 7 ਵਜੇ, ਜਿੱਥੇ ਅੰਮ੍ਰਿਤ ਮਥਾਰੂ ਜੋ ਕੈਲਗਰੀ ਦੇ ਵਿੱਚ ਇੱਕ ਸੋਸ਼ਲ ਵਰਕਰ ਤੇ ਨਾਲੇ PhD ਸਟੂਡੈਂਟ ਹਨ ਸਾਨੂੰ ਦੱਸਣਗੇ ਵੀ ਪੇਰੈਂਟਸ ਐਡਿਕਸ਼ਨ ਤੇ ਨਸ਼ਿਆਂ ਵਰਗੀ ਮੁਸ਼ਕਿਲ ਮੁੱਦਿਆਂ ਤੇ ਆਪਣੇ ਬੱਚਿਆਂ ਨਾਲ ਕਿੱਦਾਂ ਗੱਲ ਸ਼ੁਰੂ ਕਰ ਸਕਦੇ ਨੇ ਤਾਂ ਕਿ ਆਪਣੇ ਬੱਚਿਆਂ ਨੂੰ ਉਸ ਗੱਲਾਂ ਤੋਂ ਬਚਾ ਕੇ ਵੀ ਰੱਖ ਸਕਣ। ਸਾਰੀ ਸੰਗਤ ਨੂੰ ਬੇਨਤੀ ਹੈ ਕਿ ਤੁਸੀਂ ਜ਼ਰੂਰ ਪਹੁੰਚੇ ਤੇ ਨਾਲੇ ਇੱਕ ਵਾਰ ਹੋਰ ਜੇ ਕਿਸੇ ਕੋਲ ਵੀ ਕੋਈ ਟੌਪਿਕ ਹੈਗਾ ਜਿਸ ਤੇ ਤੁਸੀਂ ਹੋਰ ਜਾਣਕਾਰੀ ਲੈਣਾ ਚਾਹੁੰਦੇ ਹੋ ਪਲੀਜ਼ ਸਾਡੇ ਨਾਲ ਆ ਕੇ ਬਾਅਦ 'ਚ ਗੱਲ ਕਰੋ ਤਾਂ ਕਿ ਅਸੀਂ ਉਸ ਮੁੱਦਤ ਤੇ ਅਗਲੇ ਆਉਣ ਵਾਲੇ ਮਹੀਨਿਆਂ ਦੇ ਵਿੱਚ ਅਰੇਂਜ ਕਰ ਸਕੀਏ। ਇੱਕ ਵਾਰੀ ਫੇਰ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਬਹੁਤ ਧੰਨਵਾਦ ਆ ਜਾਣ ਦਾ। ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ।